Proposition 23.
Let's do it. Let's talk some
And
kidneys.
so just like I...
Hold on a sec.
Okay. Oh.
Okay.
Cut. Okay,
Thank you.
there's your cut point.
Okay, we'll start after the fart noise.
That's...
Is that a fart noise?
That fart noise is exactly how I felt trying to decipher this thing. That was my brain. That's the sound it was making. So I guess before we start, what are my biases going into this? My biases are I'm real hesitant to believe corporations. So the bigger I believe there's an inverse relationship to the level of trust that one should put in a corporation to the size of the corporation, right? So, or financial size of a corporation, because money corrupts. Looking at this thing, I was immediately stymied by the sheer difference in money spent in the support and opposition of this proposition. In support of this proposition, it was something like $6 million. And
No, wait.
$8 million.
Support of 23?
Yeah, support of 23 was
I'm just looking at it right now.
$6.2 million.
It's a lot more than that.
Oh, you sure?
Yeah.
What do you got?
93 million.
That's in opposition.
Yes. Oh, I'm sorry.
Yeah.
Did you say you said support? I'm sorry.
I did. Yeah.
Sorry.
In support of this is $6.2 million, and in opposition I've got $93 million. But
sorry, I
that's okay.
I stole your thunder. I'm sorry.
It's all
horrible.
good. It's all good. So of course that like that right there, it feels very much like a David and Goliath story, and so I enter it with that sort of bias, right? Going like, okay.
Except David is DaVita.
That's right.
Sorry.
Which is one of the companies that runs.
Sorry, I'm spoiling it again. I'm sorry.
That's
Bad
okay.
Anthony.
That's okay. So this is the dialysis clinic requirement initiative for those who don't know what Proposition 23 means, which is probably everybody. Dialysis, for those who don't know, is effectively a treatment for
oil change.
your kidneys, right? So for people who have kidney dysfunction, they need to go into these clinics and hook up to a dialysis machine, which filters their blood. And they have to do this it's
the latest detox out of Hollywood.
It's a continuous thing, and it's
basically an external kidney, right?
It is, yeah, exactly. And it's potentially going to become even more of an issue, more of a important thing with COVID, right? Because one of the aspects of COVID is causing damage to the kidneys. So that's another thing to keep in mind. So let's see. I started reading about this thing, and I immediately wanted to slit my wrists and go hook up to a dialysis machine, because it was painful.
You know though that a dialysis machine will not help a slit wrist.
I don't care.
Yeah.
It was just just about causing as much pain as I possibly could, because
This a kidney stone.
This was so terrible. This falls on the 2018 ballot. There was Proposition 8, which essentially involved the same groups, but what that did was try to limit the number or the amount of profit that a dialysis clinic was able to make, and that any monies above that were refunded back to the patient. That proposition did not pass. It was 59, almost 60% of California voted against it. So it looks like the same group, which is largely the labor organization that represents the workers in these dialysis clinics, started and put Proposition 23 on the ballot this year. And what this one does is quite a bit different. Instead of attacking the financial aspects of dialysis clinics directly, this one makes the law require a couple of things. One being the addition of a licensed physician to be on site anytime the dialysis clinic is giving treatment. And it requires that the dialysis clinic report infection to the state and federal government, which, interestingly enough, is not completely not done, because I went into researching that in which I'll discuss later. So there is some data that is reported, but and it's unclear as to what this would actually do.
Can I ask for a point of clarification? Because
Yeah.
I believe I'd read something in the wording that a licensed nurse practitioner could substitute for a
Yes. Yeah. So
physician.
that's right.
Okay.
So as a physician or a nurse practitioner, or physical assistant,
Which is a nurse
physician-
practitioner. is
physician's
a
assistant, rather.
doctor, essentially a doctor, but a
Right.
nurse who works under a doctor and is authorized to practice
Yes.
as a doctor under a doctor. Correct?
Exactly. Right.
Okay.
And then it also prohibits clinics from closing or reducing services without state approval, which I'm not quite sure how that would work. And
That's interesting.
prohibits clinics from refusing to treat patients based on how they're able to pay. So it opens up access. And so initially I'm thinking this sounds okay, right? But then it brought up these questions like,
But then $93 million later.
well, yeah, so
Just kidding. Sorry.
So some problems I had with this was I'm not sure if adding a physician to these facilities actually does anything. Like improves the care.
Quality of care.
Exactly. And I tried really hard to find the answer to that question, and I was not able to come to anything concrete. As it turns out,
Yeah. So what problem is this trying to fix?
Exactly,
I guess
exactly.
would be
so that's what it came down to with me, was like, okay, what are the problems here that this is trying to address? And that's the way that I approached my research into it. And it turns out that Medicare actually has a wonderful data set that you can download, that they do this really kind of comprehensive survey on dialysis centers. And I started playing around with that data, and they part of the survey is they actually get patients to rate the individual clinics, and they give them a 5-star rating. And I looked at California versus other states, and I tried to find states that that had the doctor requirement, of which I couldn't find any. So I'm not sure if California would be the first in this case. Again, that also wasn't something that was clear. But just on the 5-star rating, California didn't have any significant deviation from any of the other states as far as how they at least were perceived by the patients in terms of care. So the average in California was about 3.6 out of 5 is what they is what the patients rate it, and nationwide it's about 3.8. So it's not like a significant difference.
But we're below average.
We are, but not by a substantial amount. And I'm sure you could look at that data in different ways to like, ideally I wanted to know, okay, what states had the doctor requirement, and then look at just the states with the doctor requirement and see, how we differed, but I couldn't find that information.
It'd be nice to see too the ratings of people who have had dialysis in multiple states.
Right.
Which is probably not a very big pool.
I don't think, that would be cool, but I don't think the data really has that.
No.
Another thing that the data has, if anybody's really interested, I'd recommend looking at this data. It's really good. But they track mortality rates of all these centers, and I wanted to see if there were significant deviations in California regarding mortality rates of these centers versus other states, and we're about right on average. It's not really any different. Now that said, I'm sure there are absolutely things that can change, that need to be better about these dialysis centers. After reading about them, it sounds like there are good ones and there are bad ones. But and then the thought occurred to me, so the group in support of this proposition, they aren't without funds. They're 6 point something million that they've spent on this, and they've made such a weak case for it. They've not laid out that there's an actual problem that we're trying to solve. And if I were putting together a campaign like this, I mean, the first thing I would do is try and guess what sort of questions people are going to have about the campaign and provide information to answer those questions, right? I mean, that just...
Yeah, what are the negative health effects of not having a licensed physician on site at all times?
Yeah, exactly.
What has there been a negative health outcome that in the middle of dialysis, because a doctor or a nurse practitioner was not there, somebody exploded, or
Well, right, but I mean, yeah, and I'm sure they didn't even do that, but I'm sure with that it still it still doesn't really provide you the details that you need to have to know whether this is actually going to make a substantial difference or not. And this was by far the most flummoxing of all the propositions I've read so far, because it almost requires that an awful lot about the dialysis system in California to even begin to know where to go on this. And I have this inkling in the back of my mind that because of the groups involved here, which is so in support, it's almost entirely made up of the labor group that represents the dialysis workers. And in opposition, it's made up of entirely dialysis centers. Like, is there a shadow battle going on that this proposition is
like providing cover for?
exactly? Like,
Yeah.
like, okay, is there a labor dispute
Is there a
in
labor
there?
dispute?
Yeah. And so
Well, there must be, right? Because I mean, I just looked at the last Prop 8, the dialysis clinic spent $111 million, and they've already spent 90. They've collected 93 million. So I mean, they've over a couple of years, they spent $200 million already on these things.
that's right. Yes.
Opposing them.
So at the end of the day, like, I really want to vote yes for this thing, but like, I don't really understand the ramifications of that yes vote. So
Well, according to the ads on television, if you vote yes on this, you're basically killing everybody that has dialysis that doesn't live in a major city, because their clinic will close and you will be responsible for killing them.
Okay,
Not without state approval.
that's right. But I don't know how that works. So
That's just the argument. Yeah.
I
Well, what do you think about some of the other provisions, like the one about not being able to deny access because of
I think
ability to pay?
that's
I
absolutely.
mean, it sounds like there's a few good pieces of it, but it seems like you're getting hung up on this idea of having a nurse practitioner or a doctor there.
Uh-huh.
Well,
And,
that's a
and
good
what
reason to rewrite the bill and reintroduce it. I mean, if
In-
that's
in 2
the
years, yeah.
sticking point. But
That's true. I wonder if this is like they're trying each time they're trying to find the message that resonates, and then paring it down or going that direction with it.
The message absolutely resonates with me, right? It's more a function of I don't understand the ramifications of what I'm voting for. I mean, if I tune out all of the propaganda and just look at the straight data, I don't know what the hell. I don't know what problem we're trying to solve here. They haven't laid out the problem clearly, so it's really hard for me to make a judgment as to how I'd vote on this.
Well, part of the maybe a way to look at this is that it's an extension of the Prop 8 fight from 2 years ago, right? And one of the major components of that was capping the amount of profit that these companies can make, right? So I think part of the argument is that these companies are making lots and lots of money on this dialysis, but they're not treating their employees well, and then they're not putting as much money as they should be into basically making the service better, right? That was kind of the argument with Prop 8 a couple of years ago, and this seems like it's very much an outgrowth of that not passing, right? That's what led to this happening.
Mm-hmm.
So that's probably part of the issue. But how does some of these things fix that? I don't know.
Yeah.
Well, I guess my gut is telling me if they're willing to spend that much money to defeat the bill, then there's got to be something in that, like, just like that loss prevention calculation, right? They're looking at, I don't know. I anytime somebody spends like that much money in order to continue to operate the way they've been operating, it lets me know that they're very invested in operating in that way.
Mm-hmm.
Yeah.
But I also agree with Jason that I'd like to know what the negative outcome to a patient's care is that we're trying to prevent. And I imagine, and make that case, right? Make the case that there are people that basically they're literally going to die if they go one day more without dialysis than they should have, or they're going to go into a coma, and then the chances of coming out of that coma are very slim.
Right.
So this is literally like a matter of life or death for people who are hanging on by a thread.
Yeah.
And if somebody shows up and there's been a problem with their insurance and it's an administrative error, then they're going to die because something got crossed in the mail.
Sure.
Obviously these dialysis clinics are making enough money that they can put in, what was it? You said 200 million
Almost 200 million.
Over the course of 2 propositions.
Yeah. So, maybe that's the problem we're trying to address, is the fact that the quality of care, or even just the accessibility of care, and the fact that they're using the kind of the tactics, like if you vote yes on this, then this person we paid to say they're on dialysis is gonna die.
I agree with you completely. I started trying to watch videos on this topic, knowing full well that the group that can afford getting videos made about this is going to be the opposition, and I didn't make it but a few seconds through any video because they always opened it up with "You're gonna kill people," and it's like, fuck you, get out of here with that shit, and actually make your case without just your constant appeal to emotion. Well,
that's kind of like I saw that Mothers Against Drunk Driving is supporting a yes vote on Prop 22 because because these services save lives by preventing people from driving home drunk.
Okay.
But there's still taxis. There's still there's still the AAA free ride home program.
That sounds to me like Uber or Lyft made wonderful donations to Mothers Against Drunk Driving. But okay, so where do I stand?
Sorry, tangent. Sorry.
I'm not sure yet. I'm going to do some more reading on this and see if I can answer some of the outstanding questions that I have. I'm leaning to voting for it, but that's very soft. Like I could go either way on this one. And the reason I would vote no on this is just simply because I don't understand the problem. And I'm not sure if there's a problem there, and it feels like I'm being used as a voter to address some other shadow issue, which honestly I might very well be on the side of the people in support of it anyway, but I'm not cool with if that were the case, I'm not cool with them doing that, right? Because the argument that they're making then is, oh, it's about the patient, it's all about the patient, but really it's a labor thing. That rubs me the wrong way.
Sure. Well, just call it a labor thing, and
exactly.
I mean, but the difficulty is it's very difficult to separate having a healthy work environment with good relationships with positive outcomes.
I agree.
Or good care. I shouldn't say positive outcomes. I'm not a medical whatever, but the thing that really gives me pause is that they've been able to spend so much money. Just a couple of companies, really, these dialysis clinics, they have so much money on hand to spend that it really seems like the cost of dialysis is way too high. I mean, granted, in general, I think the cost of healthcare is way too high because of this gigantic fucking patchwork system we have. But that by itself doesn't necessarily mean to me that it's like, oh, well, that's just an automatic yes vote because fuck the corporations. Well, I mean, yes, but
right.
Yeah.
So that's where I am in a nutshell. I mean,